So my name is Dr. Mohit Bhutani. I'm a respirologist and a professor of medicine at the University of Alberta. I work in lung medicine primarily. I'm a clinical clinician, an educator, and a researcher at the University of Alberta. So what does COPD stand for? It's a bit of alphabet soup. It stands for chronic obstructive pulmonary disease, COPD. And what it is it's a disease, it's a chronic lung disease that has a manifestation of certain symptoms, such as breathlessness with activity or even at rest, a chronic cough, and some mucus production. It's a disease that is also marred by having acute flares of them. In the medical world, we call them acute exacerbations of COPD, but other people might have heard of it as lung attacks due to COPD or acute flares due to COPD, but they in fact are the #1 cause for hospitalizations in the country. So it's a disease that not only has sort of chronic disease symptoms, but it actually also has acute flares that can result in hospitalizations. The way that COPD develops in all patients is it's inflammation that occurs within the lungs. So whether it's tobacco smoke or environmental smoke, it all results in inflammation within the lungs. And what you've got to think about is the lungs being like a balloon. So you think about a normal balloon, it inflates and deflates. You blow it up, it comes down real fast. It goes up, it comes down real fast. That's what a normal lung should do. The damage that occurs due to the inflammation within COPD makes the air getting into the lungs not so difficult, but the air to get out is more challenging. So patients tend to stack their breaths. So this is a nice model. I think what it nicely demonstrates here is the differences between, on the left here, a healthy looking lung, and on the right here, a diseased lung secondary to COPD. And right away you can see a couple of different things. One is just the color. You see that the left lung there is nice and pink because the blood flow that goes into the lung provides oxygen, and as a result of it, it's nice, pink, and healthy. The diseased lung on the left side demonstrates it's more blackish, and that's a resultant of the tar and the inflammatory cells that deposit within the lung tissue itself, and it's causing actually a physical discoloration to the lungs. So when we see lungs that are of patients who have had COPD, you realize that this tar deposition is actually fairly significant throughout the lung. The second thing is looking at the size of the lungs. And so if you remember, we talked about the lungs being like a balloon. The lungs should be normally nice and small and spongy. It's a very spongy organ. Whereas somebody with COPD, because you lose the sponginess of that lung and the lung tends to then trap air, you can see that there's a size difference between the right and the left. So there are a number of different risk factors for patients to develop COPD. Without question, the #1 cause is exposure to cigarette smoke. And it's now, as we understand, that cigarette smoking certainly is very commonplace, but other types of smoke exposure like vaping and e-cigarettes and also marijuana smoke are also risk factors for the development of COPD. But without question, cigarette smoking is the #1 cause. But there are other causes that do exist. The other ones that we think about are occupational exposures. So people that are in the mining industry, welding industry, even in the agricultural industry, they can develop COPD from the exposures that they have at work. Also, we look at pollution, whether it's indoor or outdoor pollution. Both of those exposures can result in the development of COPD. And then lastly, there is a rare but important genetic condition called alpha-1 antitrypsin deficiency. It's a bit of a mouthful, but it's a very rare condition, but it tends to cause COPD in a younger population. So when we see patients, and sometimes we hear from them that, doc, I've never smoked a day in my life, how do I have COPD? We have to go through their history and their work exposures and their family history to get a sense of, what are the risk factors that go beyond tobacco smoke that would have resulted in them developing the disease. So what's the difference between emphysema and COPD? You have to think about COPD as being a bit of an umbrella term. Okay, so the major two types of diseases, that subtypes of diseases that sit under that umbrella are emphysema and chronic bronchitis. Okay. The interesting thing about COPD is that the prevalence of COPD over the last 15 years has been increasing. In Canada, we sit at a rate of somewhere between 8 and 10% prevalence of this disease. One of the troubling things about COPD is that the majority of patients currently living with this disease are undiagnosed. So depending on which report you read, somewhere between 50 and 80% of patients currently living with COPD are undiagnosed. So to put that into perspective, right now, why that's such an important number is that right now it's the third leading cause of death worldwide. And that comes as a shock to many people when you hear about a disease that you may or may not have heard of, and all of a sudden it's the third leading cause of death worldwide. The second thing is it's the number one cause for hospitalizations across the country. Those are the patients that we do know that have COPD. There's 50 to 80% that are undiagnosed. So if we're actually going to change the curve of hospitalizations and death, we need to find these patients. We need to find them, we need to diagnose them, and we need to get them on the proper chronic disease management strategy